Welcome, everyone. This is a joint meeting with House Human Services and Senate Health and Welfare, May 12th. And good morning, everyone. We're a little happier for the lack of snow that we see, at least in one of the pictures there, and happier about the photograph behind Representative Pugh. So even if it's not warm out, it still looks a little bit like spring. So we in the Senate have been looking at some emergency planning issues. Before the pandemic began and the emergency order was issued, we had looked at a bill, S-185, that is currently on the calendar in the Senate. And that bill directs our regional planning commissions to work collaboratively with hospitals and other healthcare providers to ensure that during in the bill itself, it talks about climate change disasters. And so it looks at how to best respond to those climate change disasters from a health perspective. As we were going through the bill, we realized that our emergency plan for the state has a very low rating for health issues. In fact, it's quite at the bottom. So most of the emergency response is related to weather-based disasters or similar, like fires and other things, so that we don't have a robust health planning process in the state. We decided with S-185 that bill we'd already worked on, and it wasn't a statewide bill. So we put off any decision making about how to move forward on statewide emergency health planning. And as the COVID emergency was coming upon us, we thought we'll take that up at another time and we'll deal with it after we've had all the work that we've been doing. Your committee has been working so hard, Representative Pugh, and we really appreciate the work that you did on Act 91. It helped us tremendously. And so S-185 is there, and our committee now, through some extraordinary help from Katie McClin, has put together a bill on statewide emergency planning. We had one hearing on it where we invited the Secretary of Administration, Suzanne Young, to come in and respond to the proposal. Her comments you can see on YouTube from last week, but her comments were mostly related to the timing of how this might be implemented. So as you go through the bill, you'll have your own ideas about how to improve it. Our goal in the Senate, I think, is to continue to work on the bill and try to get some testimony from other members of the administration so that we, going forward, will have a state emergency plan that includes healthcare fundamentally, and public health response. So that's kind of the background for the bill, and I hope it's been clear. If anyone has questions, I'm happy to answer them at this point, but I think it might be helpful to have Katie go through the bill. So why don't we see first if anyone has a question about what we've done so far in the Senate. Okay, any senators wish to add anything? Okay, that's great. Representative McFawn.
Senator, I'm trying to find it, and all I have is the one as introduced. Is there some place that I can find the work that you've done on it already?
Are you talking about S-185 or the new bill? Okay, S-185 is we will not be dealing with in our joint committees because it's already on the calendar. But we are looking at another bill. Right now it's a Senate committee bill, and Nellie, that it's on our webpage, on the Senate Health and Welfare webpage. And Julie, I don't know, have you posted it on
Yes, it's also posted to the Human Services webpage.
That's great. Okay,
Okay,
so
good. Thank
yeah,
you.
so there it is. Okay, that's good. I probably should have been clearer that we're working with a entirely new bill. Okay. So Katie, why don't we all find that bill? And Katie, thank you for persevering. And why don't we go through the bill draft 1.1 that you have for us?
Sure. So Nellie is able to pull it up and share her screen so we can all look at it at the same time. There we go. Thank you, Nellie. So Senator Lyons said the Senate Health and Welfare Committee looked at this piece of legislation last week, and we did a detailed walkthrough. House Human Services, this is the first time you're seeing this bill, so we'll do the same detailed walkthrough. But before we start, just to give you a big picture of what you're looking at in this language, the bill does a few different things. At first, directs detailed data collection for all of the state entities that are involved in the COVID response, kind of lessons learned, what went well, what didn't go well, and we'll look at that language. And then it asks the Secretary of Administration to head up a task force to look at how to prepare for a future statewide healthcare emergency with the goal of creating a strategic plan to address that emergency. So those are the two components that you'll see. Nellie, if you could scroll down to the first section. Yep, perfect, right there. So first in subdivision A1, this directs that by January 1st of next year, 2021, the Secretary of the Administration is to begin consolidating data collected by each department and agency involved in Vermont's response to the pandemic regarding their respective role in responding to the pandemic. And then we go on to have a list of what that data includes that responsive departments and agencies are giving to the Secretary of the Administration. So if you scroll down, that list begins at the top of page 2. Great, thank you. And subdivision A, the responsive agencies and departments would be submitting information on policy modifications implemented in response to the pandemic, including the effectiveness and limitation of each modification. And subdivision 2, identification of any populations, regions, or infrastructures that would have benefited from a more timely or robust state interventions, or both. And the Senate specifically had a conversation about that particular piece of data collection and considered possibly separating out the populations piece so they could be more specific on what populations we were looking for information on. And subdivision C, responsive departments would be reporting on alternative responses and policies that would have better served Vermonters. In subdivision D, opportunities to prevent, mitigate, and better respond to future healthcare emergencies. And lastly, in subdivision E, any other relevant information necessary to ensure that Vermont's experience during the pandemic informs future statewide health responses. And then this paragraph directly below it, subdivision 2, says that by August 1st of 2021, responsive departments and agencies are to submit all the required data to the Secretary of Administration. So I'll just pause there to kind of give you an idea of what the time frame is. So the data collection portion of the bill would start on January 1, 2021 and would close on August 1st, 2021. So there's a 7-month period beginning in January for the agencies and departments that were most involved in the response to COVID to collect this data, submit it to the Secretary of Administration, and the Secretary of Administration during this period is kind of consolidating this data and gleaning lessons learned. When we move to subsection B, this is where we start looking at the creation of the task force. So the task force would be created by August 1st, 2021, and it's the Secretary of the Administration who would convene the task force for the purpose of evaluating the state's response to the pandemic and developing a strategic plan for addressing future statewide health care emergencies. Subsection C looks at the membership of the task force. First, we have the Secretary of the Administration, who is serving as the chair. And then we have the Agency of Human Services. That should be the Secretary of Human Services now that I'm reading through it out loud, or designee. The Commissioner of Health or designee. Commissioner for Children and Families or designee. The Commissioner of Dale or designee. The Commissioner of DEVA or his or her designee. The Commissioner of Corrections or the designee. Commissioner of Mental Health or their designee. The Commissioner of Public Safety or designee. Secretary of Education or their designee. Commissioner of Labor or designee. The Secretary of Commerce and Community Development. The Secretary of State or designee. And any other person that the Secretary of Administration believes would be helpful in carrying out the task force's charge. So that's the membership. And then we move to the responsibility of the task force. In subdivision D1, the task force is required to review and use data submitted in subsection A. So that was all the data that the responsive agencies and departments collected. So they're reviewing that, using the data that was collected, and they're creating a strategic state plan for addressing any future statewide healthcare emergencies that could arise. By November 1st of 2021, the task force would submit the proposed strategic plan to the General Assembly. And in submitting that, they would highlight any legislative changes that would be necessary to implement the final strategic state plan. And then on the top of the next page, we have subdivision D2, and this is an opportunity for the General Assembly, the subject matter committees, to weigh in. So by June 1st of 2022, after soliciting input from the relevant subject matter committees of the General Assembly, the task force would adopt a final strategic plan for healthcare emergencies. The task force would have the administrative, technical, and legal assistance of the Agency of the Administration, and the task force would convene no less than 4 times to carry out its charge pursuant to this section. So that would be 4 times between when they first meet, August 1st, 2021, through when the first proposal is due, November 1st, 2021. And then they would have an opportunity to come back and meet again after receiving input from the General Assembly. In subsection F, the task force would convene not less, oh, I already read that, I apologize. And in subdivision F2, the majority of the membership would constitute a quorum. And this act would take effect July 1 of this year. And that is it. Oops, Senator, you're on mute.
Thank you. Before we take it off the screen, are there any questions of clarification about the language itself? Why don't we take it off the screen, Nellie, and then open it up for questions for Katie? Questions or comments from folks? Representative Pugh?
Thank you. I guess two sort of quick questions. One, are you defining what a healthcare or what a health emergency is in terms of that? And the other question, and actually, let me start over and say, I'm so glad that you are doing this. I think it's really important that we take a look at how the state, working with the community and working with legislators or not, how it's gone, and sort of doing a review and evaluation. I think that that's really very helpful. I think that's just a great idea. So the fact that I have questions doesn't mean that I don't think it's a good idea. Thank you, Senator.
It's good to have questions.
And the other is in terms of the bill will take effect, the date the bill is going to take effect, when, if I remember what you were going through, Katie, nothing starts until January.
Mhm.
And so wondering if, wondering what's supposed to happen in January, between June and January.
Mhm. So with regard to the definition of a healthcare emergency, you're right in pointing out that this does not have a definition of a healthcare emergency, but that doesn't mean that the committees couldn't choose to add one or, be specific on what the committees see as a healthcare emergency. So that is certainly something we could flag for future conversation. And you're right, first, with regard to the effective date, July 1, 2020 is when the act itself goes into effect, but there's no required action until January 1, 2020. And even at that point, there's still a 7-month period while the data can be kind of rolling into the Secretary of Administration. There's nothing requiring an agency or department to submit anything, on July 1. So what is happening in that period? There's no required response from an agency or department between July 1 and January 1.
If, I guess, you could think about the time, the effect date is probably something we should consider. You might, if I were in a position of being on that task force, I might see this legislation and then begin to collect more rigorously and systematically everything that we've done in the agency and outside in the community. So it is, but it's, I think, a very valid question and a good one. Do you have any more questions, Representative Pugh?
It's probably more in terms of bringing myself and maybe the committee up to speed in terms of what is the state's emergency response plan now? What is the structure of it? Is it in legislation? And where does this fit or not fit?
Katie, do you want to talk a little bit about the relationship between the federal requirements and, as much as we know at this point, before we've had testimony about
Sure.
our, okay.
There have been Senate Health and Welfare hasn't received a lot of testimony to date on these different types of plans. There's a hazard mitigation plan, which when I looked into that, that's a federal requirement. FEMA requires states to have this hazard mitigation plan in order to draw down certain grant funds. So there's that plan. And then there's also a state emergency plan, and it's updated. It looks like it's updated every 5 years. It was last updated in 2018, and it looks like it was a product of an executive order. I'm just going to switch my own screens here so I can give you a little bit more information. So on January 4th of 2019, I'm sorry, 2019, not 2018, the executive order was signed, which promulgates the revised state emergency management plan. The plan addresses Vermont's hazard and threat environment, including natural, technological, and human-caused emergencies and disasters. And it's the basis of Vermont's emergency management system. So,
Thank you.
yeah.
I mean,
We have actually, we invited David Englander of the Department of Health to testify today. He's unavailable. And we invited Erica Bornman, who is the head of the emergency management process and plan, to testify tomorrow, but she's unavailable. So and I am talking with Mike Sherling of Public Safety this afternoon to clarify their interest in providing testimony for this
Right.
particular bill.
Right, you did email me about that, and I just emailed you back to say, am I joining you? You invited me to join, and I don't know if I am or not. We'll figure
It's
that
at,
out.
yeah, we can. It's at 4:30. So I don't know, but I will keep you posted on how that goes. Okay, so so you can see we're really at initial stages in discussing this particular piece of legislation. And we thought it important to include you folks because this really falls into your area and your jurisdiction around public health planning. I have a number of hands up. I'm going to read through the list in order that they have appeared from Nellie. So Jessica Brumstead, Sandy Haas, Dick McCormick, and Topper McFawn. So we'll start out with Representative Brumstead, please.
Thank you. And thank you, committee, as well for putting together this bill. It makes me think honestly about the Government Accountability Committee, which is always the drumbeat that I seem to hit. And Susan Zeller. And I can't think of what her title is, but I wonder if somehow she should be involved in helping to collect that data, because that's part of her role, is making sure that the data we collect is collected in a way that can be consistently looked at over time. And I do think that even though we'll learn something from this experience that will be sort of finite in a way, you know, it'll happen and we can collect it, I do think it'll keep going, because there are things that are going to change in Vermont due to what has happened with COVID-19. So it's real important that our agencies realize that and are able to collect data that makes sense. Again, though, it costs a lot to collect data. We talk about this over and over again, and I know one of the big things on our list of maybe one-time only monies in the budget is going to be better IT systems. So again, it just all sort of folds on each other. And I just think the Government Accountability Committee probably should at least have a sense of this and maybe talk about it with someone like Susan Zeller. I think often that the questions we ask are, what happened? How did it go? And is anyone better off? And so aren't those similar to sort of the questions we might want to ask as part of this legislation? And then what the next question might be about, how do we do it better next time? So anyhow, I just bring that up because at least in the list of who's on the committee, maybe there should be some mention of the Government Accountability Committee. And then also possibly Susan Zeller could be part of collecting the data with the Secretary of Administration. So
Forgive me for not knowing, but is Susan Zeller in the Agency of Administration?
yes.
Yes, that's what I thought. Okay, good.
She works directly for the governor, I think, overlooking collection of data and things like that.
All right, thank you.
And
Well,
Betsy, Katie should know, Betsy is the one who is our staff person, so, okay.
Good suggestions. Thank you. We have Representative Haas is next.
So I just have a quick question for Katie. In your list of task force members, everybody is entitled to a designee except the Secretary of Commerce. And I wondered if that was intentional.
No, I caught that too, and I added it as we went through. Thank you.
Okay, and I've had a note from Nolan, and it is Sue Zeller's title is Chief Performance Officer. So that's a good one to know. Thank you for that. Thank you, Nolan. Is that your only questions, Representative Haas? Okay, good. So we'll move on to Representative McFawn.
Thank you. My question is, between July 1st, 2020, when the gathering of information starts, and January of 2021, is the information that's being gathered, is that going to be privileged?
I can't answer that. Katie, can you answer that?
Well, first, I just wanted to back up and clarify the timeline. So while the bill goes into effect on July 1, 2020, there's no requirement for a data collection to begin until January 1, 2021. So there's really no data collection happening between July 1 of this year and this coming January. The data collection happens between January 1, 2021 and August 1, 2021. And there's nothing written into the bill at this point about anything being collected being privileged.
So it would be open to FOIA requests and to legislative requests or others.
Potentially, yes, yeah.
Okay. Does that answer your question, Representative McFawn?
Yeah, yeah, it answers it.
Okay,
I'm looking at those questions. And I can read into that. There's, questions like, would people have benefited more from a more timely, a robust state intervention? Alternative responses and policies would have served Vermonters better. I go down through those questions and I say, that information, well, I think I'll just leave it at that. Thank you.
is your concern liability or is it the way it's written?
Well, my concern is I'm not against gathering the information. What the use of the information,
Yeah.
I can see a very particular use of that information in an election, as an example.
Oh, okay. Yeah, I don't think that's the intent at all, but we
I'm
can,
not saying it is.
yeah, yeah,
I'm
yeah.
not saying it is. I'm just saying that they're pretty strong questions, and we're using words effectiveness and the limitation of each modification that was done to a particular policy. I mean, I'm sitting there thinking, and I'm saying, this information, if I'm running for office and my opponent gets this information, then comes out says, well, look, if this guy had only done this a little bit different, this would have been better for the people of Vermont. I'm just going to leave it there. And
Okay, this is a good point
But
that
thank
you made. Thank you for that observation. Maybe the language appears to be value directed, and we can probably talk about how to make sure that it is data and it is more it's objective and not subjective in the collection.
that's why I asked if it was privileged
Yes, thank you.
and
Good
protected.
point. Good point. I believe that Senator McCormick, you are up next, and then Representative Redmond.
Thank you, Madam Chair. Demonstrating the unity of purpose of the Upper White River Valley, Representative Haas has already asked my question, so I'll
Oh,
pass.
okay. Representative Redmond.
Thank you. Not wanting to micromanage the data collection piece, but I am concerned about the fact that, various departments and agencies have an idea of what's important to collect, but maybe it's not what we need to collect. And, maybe there are different or more expansive data points that need to be collected. So I'm wondering if in this bill, there should be, not determining what data to collect, but perhaps a time frame for the Secretary of Administration to make clear a scope of data collection, so that people aren't just passing data, but maybe it's not the right data that needs to be collected, but some kind of benchmark in the bill that would task the Secretary of Administration with having to set a scope of what needs to be collected, as well as maybe a time frame, that she or he would deliver that, that requirement. So just kind of trying to build something in there that's going to give people a clear sense of what they need to be imparting.
As you're looking at the bill and you're looking at sections of the bill, can you, which sections would be affected by that? Would you change the initial policies that are in there in the first section?
I don't think so. I feel like it lays it out nice, but what
Okay.
I'm talking about is just putting in like a point in time where there's some kind of communication from the Secretary of Administration to say, here's what I'm expecting, here's what I want. You know, as far as from your particular, area or agency or department, like, here's what I'm expecting. Or because I sense that this is where we're going to figure out the data points that are missing, that the pieces that we're not collecting. So I just think it's important that it not just be up to the department head, but that there be some kind of sense or expectation of what the secretary is expecting. And take it or leave it. It's just something that stood out to me as kind of a, like, if I were in that position, like, I'm just expecting people to throw data at me as the Secretary of Administration, but is it necessarily what I expected or wanted?
Does anyone want to comment on that? I think this is worthy of a little conversation. Senator Cummings, go for it.
Well, I think this discussion points out one of the basic flaws in that this is not on the initiative of the Secretary of Administration. We are telling the Secretary of Administration, you shall do this, but we haven't set out any criteria for data. And I don't know that we can assume that the Secretary's definition of useful data and our definition would be the same. But we're still in the middle of a health crisis. And we don't know what's being collected now. And that might be a place to start. What is being collected as we go?
If anything.
Conflict. The secretary did not say to us, she just stopped short of saying, don't do it to us. That if we want this done, then we, I think, need to decide what kind of data we want collected and not just all data.
Yeah, and I think that's getting to my point, is just where's the sense of framework or scope around what data is really critical. Thank you.
That's a very good point. Yes, so obviously when you put something like this together, you think everyone is thinking on the same page and thinking about the importance of having some healthcare emergency plan going forward. But having the criteria for data collection absolutely makes sense. I think immediately of what are the sequence of policies that have been put out by the Department of Health regarding PPE, masks, whatever, for different venues. What is the sequence for reopening? What is the sequence for closing down? All of those things have been written into policies. So our assumption would be, oh gosh, everybody's going to take some time to look at those retrospectively as the pandemic slows down or the emergency transitions. So those are excellent comments. So we're going to have to think through how best to get at that. I think the Secretary of Administration was concerned about the timing of this and was wanting to see the collection begin later than January 2021. So I think that was her biggest concern. And then suggesting that we talk with Erica Borneman and others who are currently in the emergency planning process. Senator Ingram.
You, I wonder if we shouldn't use, well, two things, I guess, to the previous point. I mean, I think that a lot of data is actually being collected. I mean, we may not know exactly everything that's happening, but certainly the health department has, already has a dashboard, and they're collecting all kinds of things about how many cases there are, and where they're located, and what age people are, and race, and that kind of thing. And then we've heard, some other things in education, Senate education, about what's being collected in terms of the, the schools. And but it's point well taken that perhaps defining it more might be helpful. But I wonder, I've been kind of cogitating on this word collection, and wondering if, I mean, maybe we should use the word compilation. Won't start until January, because I mean, certainly data needs to be collected now. I mean, we can't do it retroactively necessarily, but we're not asking the people who are, on the front lines in the administration to compile it and, in some kind of presentational way until 2021. So
what is your specific suggestion, Senator?
So to change from collection starting in 2021 to compilation.
Okay. And then evaluation and placing it into a plan comes later.
Yeah, well, yes, I don't have it in front of me. I'm sorry,
Yep.
I've lost it off my screen. I have too many other things, but yes, that's the idea.
Okay. All right.
Senator Lyons?
Yes.
What is in your vision for what the outcome of this is, of what the plan is? I mean, so I mean, what are we looking for? I realize from where I am sitting right now, the interfaith, the interconnectedness between availability of childcare and opening up the economy, it appears to be a bit rocky. It may all work out fine, but so part of what I'm curious about is what is the communication and how, those kinds of things. The fact that people get jobs or people get unemployment, or these many people, we didn't get the surge that we thought we were. And some of those are less important to me right now in terms of how do we respond better next time. But I don't know if that, I mean, so I don't have any suggestions, and my question is really one of curiosity in terms of what is your vision? This is your vision. And so what is it that you are hoping to get out of this?
I think
just one other thing.
Yep.
And Representative Redmond, I thought maybe you might be speaking to this. For some reason, the word data, I think of numbers.
Right.
And I think stories are really important, or in the world of academia, more qualitative, looking at or exploring what happened and what worked and what didn't work. But again, if I'm going down a path that was not the path that you are laying out, that's fine.
No, I think actually what you said hits the nail on the head. It's how do we respond better next time? How do we ensure that the childcare system is ready to, has some flexibility in it so that, that people have some predictability about where their kids are going, and the childcare centers understand their role, at least some policies. And you mentioned data, and data for me both, sure, it's qualitative and quantitative, and folks will be utilizing that information, and they are using that information, we all are, to develop critical policies that we will have in our hip pocket next time. So I'm trying to understand how we get at having the system in place, and the bunch of systems that represents our emergency planning, healthcare emergency planning, so that we can do it all better next time. And that does, maybe we can't do it better next time as far as reducing the number of severe cases. We've done a pretty good job at that. And maybe that shines as, an outcome that we can use the next time. So,
And maybe that's all that matters. But
yeah,
I'm curious as to who is at the table, who is
Sure.
making, and who is not at the table. Now, and does it matter? I mean, we may have figured out, the state may have figured out how to go from A to B without certain groups or or
sure.
organizations or quote unquote stakeholders at the table, but they've figured out what to do. Maybe they don't need to be, but
Okay.
so,
Okay, thank you. This is, this opens up a broad reflection on next steps. I've got three more folks. Representative Haas, and then Representative Rosenquist, and then Representative Nicole.
So thank you. I just wanted to follow up on Representative Redmond's observation. And I wonder if it would make sense, since we're asking the administration to do this next year during the time that the legislature is in session, to have some kind of report back, maybe from the Secretary of Administration, with the list that she's sending out to various departments, saying this is what I'm looking for. So, maybe, I don't know, February 15th, she would report to your committee, to both committees, with what she is asking, and that would give the legislature a chance then to weigh in and say, oh, that point is really good. How about we add this, or maybe just a little more input.
Okay, good comment. Representative Rosenquist.
Thank you. I know in the military, after an event or an action or a campaign, an after-action report is written by the chain of command that outlines what actually happened, who did what, et cetera, and that there's a separation of that report, which is usually done by, as they say, the direct chain of command, to the formulation of policy or to address certain things that maybe could have been done better going forward. But this looks like we're putting the two things together, the actual after-action report and the development of policy. And I don't know if that's the best thing to do. Sometimes that muddies the water because people might have an agenda in even the after-action report before you get to the policy. So I'm just suggesting that it might be better that we task the administration with preparing an after-action report. And then based on the after-action report, we as the assembly look at it and see if there should be some policy changes in going forward.
Okay. Thank you. That's very helpful. It pays to be in the military. All right, Representative Nicole, and then Representative Brumsted.
Yeah, I guess I'm just wondering, I know in our committee, we tend to really like intent language. And so I was sort of curious about if there was any area just to clear up some of the intent around that the purpose. I think it's fairly clear just in the way that the sections are worded, but just listening to Chairwoman Pugh's comments, that's sort of what came to mind. And then there was one other thing. Oh, I was interested in if there was any discussion about creating some sort of an environment for public comment, to have the task force hold public hearings or something else to invite, just the general public to be involved in and give feedback on. I mean, I know it's when it goes to the legislature that you have that ability too, when, the legislature's hearing testimony, but I wonder if there was any discussion or any thought about involving them earlier in the process.
We have not talked about that yet, but it's an excellent comment. Thank you. Representative Brumstead.
I wanted to thank Representative Rosenquist. Excellent point that this is what we do in the military. And it made me think that this is what hospitals do when someone dies. And they do a whole report on how did it happen, what was done right, what was done wrong, and what did they come out with? Like, we did everything we possibly could, or we missed a few things, but they always start with what was done right too. And they look at process as well as specifics to do with that. So, could the process have been better moving through departments? And so both of those kinds of reports would be great to look at, to say, okay, this may be the way to look at this. I think what goes right is as important as what didn't go right. I mean, what didn't go right. So what happens the way it should and what doesn't. Anyhow, thanks.
No, good. That's a great way of expressing it. And you're right about how the way hospitals deal with deaths. Very helpful. All right. I don't see any other hands up. Anyone else? I guess my question is, as we, it sounds like we're interested in continuing work on this piece of legislation. I don't think it's going to be easy, and it's not easy for 1,000 reasons, not the least of which is where our state emergency plan sits. It sits in the area of public safety, and it has been traditionally more related to hazards, environmental hazards, rather than healthcare. This is the biggest, I think, other than Irene, where people were separated from their prescription drugs, their pharmacists and their hospital access. This is probably the largest health emergency that we've had in the state. And so I just think the difficulty is linking together those folks who have been thinking more about hazard mitigation and those folks who are thinking more about healthcare. And I do agree with what's been said about the separation of policy from the data collection and the type of data collection. So this has really been a very helpful meeting for those of us on the Senate Health and Welfare Committee. I think for all of us, appreciate it. Representative Pugh, I can see you're ready to turn off your silence. No? Okay. All right. Any other comments, questions? I guess the question I would have, and I'll turn to Representative Pugh first, to how should we proceed on making, I think it's very important that we make some changes to the proposal. I think the first step, however, is to gather some information from other folks in the administration who have been involved in emergency planning. So that's a comment and it's sort of a question.
I think that makes perfect sense, and where we can be helpful and where it makes sense for us to do this together, we can try to do that, and where
We get it. I do know that our time is going to be compressed very radically in the near future. We're already feeling the stress of our joint meeting process. And we're hearing that that process is going to be slowed down, and that's okay. We can still work together even when we're not together every meeting. But what is helpful is having your basic understanding of what we might be sending over to you, and so that we can stay connected on that.
that makes sense.
Okay, good. Well, we'll do as much as we can. Representative McFawn, you have your hand up.
Thank you. I have a concern
Okay.
in terms of time. I go back to the last all house session that we had, and I think it was a couple of hours, it might have been more. We passed 2 bills. And we've got budget stuff coming up. We've got all kinds of things that are directly related, not saying this isn't. This is something that I see happening in the future, but that are directly related now to what's going on. And I'm just wondering how we're going to fit some of these things in. I hope that the unemployment situation gets straightened out, because that's taken up a lot of time, personal time. I'm trying to, in other words, I'm trying to say, adding something new like this on top of what we're already trying to deal with. This daycare thing, I think, is going to take a lot of time to get it right. And I personally would rather spend my time on that, because it's going to affect people right now, than this. I think this is something that I see in the future. And I think we can maybe take a look at that in August or September or sometime like that, rather than trying to do this now.
So good.
That's
I
my
think,
personal opinion.
no, very good comments. And as we go forward and look, I think it's important for us while we're in the middle of it to get a sense of what is important to collect and how to build this particular piece of legislation. And as people are available to us to take testimony. But the fact of the matter is, it may be something that gets put off until the fall. We don't know. We'll just have to see how things go. Representative McFawn, we have no idea how quickly we're going to be able to move through various bills and what's coming. So I have no illusions that we can knock this out in a couple of days.
Well, no, I don't think so either.
Yeah.
I would like to follow up on Representative Brumstead and Mary Beth and others that have talked about what went right. The
Good.
way I look at these ABCD, it's all about how could we better respond in the future? What would have been better for Vermonters? What would have been more timely or robust? The inference to me there is none of this was done right. And that's what bothered me when I made my first statement.
Oh, okay. I see it. I absolutely see it. I think that that makes a lot of sense. And that
So-
really gets at the value-based language that we were talking about.
Right,
Yeah,
right.
good point.
Okay.
What's right is
Yeah.
we've done a lot right, and now we're going to make childcare right, and hopefully
I hope so.
UI will sort out. There's a lot, but
Yeah.
you know,
And
yeah,
let me finish by saying, I appreciate this kind of thing being put together to get us started, because I think it's crucially important, as Representative Rosenquist so adaptly said. You want to find out what went right and what went wrong, both. One and then the other. And then you set the plan of action for what you're going to do the next time. Thank you very much for bringing it forward, Senator.
well, thank you. I think this has been very helpful. It's been extremely helpful, I think, to all of us. And I think Representative Pugh said it best. How do we do it better next time? What did we do right? And how do we improve it? Makes a lot of sense. It is 11:05. I am inclined, because we don't have additional witnesses. I know I had asked Nolan to talk briefly about budget adjustment, but I understand that your committee is looking at that this afternoon, and we're going to be looking at that this week. I'm not inclined to hold us any longer than we need to. Nolan, I'm asking you, do you have something special developed for us, or would you be very disappointed if we, look at his face. He knows I'm going to say adjourn.
No, I'm always happy to serve at the pleasure of the legislature in any capacity.
Well, we want a full analysis of all the federal dollars and how we might spend them right now.
You got it.
Okay. No, Senator McCormick, no,
Nolan.
Nolan, thank you. We're good. I think we're good.
No, from now on, I'm going to think of Nolan as Eddie Haskell.
I don't know if that's a compliment or not, but I'll take it as one.
It's a compliment.
All right. Here's what I'm going to suggest then. I'm going to suggest that I'll talk with Katie a little bit, and perhaps Representative Pugh might chime in. We've heard a lot from each one of you. You've had excellent comments. I think our goal is to build some testimony around this issue. What did we do right? What can we do better? And how do we build that into a plan going forward so that when we hit another one of these healthcare emergencies, we're prepared. I think that's really it. So unless anyone else has a comment, a question?
I don't have a
Representative
comment, more a sort of process. At one point in time, our committee was going to join you tomorrow at 9 to hear from people who we can't hear from. So I'm not sure that it makes sense for us to do it.
No, it doesn't, unless my meeting at 4:30 brings us additional testimony. And I can't help you any more than that. So be prepared to either attend or not attend at 9. I will try to get you information right after my phone call at 4:30, and I've had time to communicate with Nellie. So that's where we are with that one. And I have also reached out to the Department of Health again. So we'll see what we can do.
Madam Chair,
Yes.
did you understand the pro tem to say we're having some kind of all Senate call tomorrow, or have you been told that?
No, I don't know.
No. Oh, I don't know what's happening.
I know we're going to have an all Senate something, but I do not know the time at this point. Senator Cummings or Senator McCormick or Senator Westman, do you remember any time frame with that? Okay. We're all in the same place. All right. Senator Westman, do you remember when our all Senate call is?
We have rules at 8 and
rules at 8.
And then I thought there was a chance that it would follow the rules at 8.
Okay, there's a chance of that. And that's
concerned that it would
if we get testimony, we're going to have a conflict. So we'll keep that in mind. And Katie can't be with us until a little 9:20 or 9:30, so we may just move our start time. Okay, I'll keep you posted. You know, everything is totally in flux all the time, so it's business as usual. Thank you all for being here today. I greatly appreciate everything that you have contributed. I know at a short notice, it's a new bill, it's a new concept, and any further thoughts that you have for improvement, we would greatly appreciate, and we'll do the best we can on this one. Whether it pops out before we adjourn in June, or whether it is held over for another day, that remains to be seen. So we are finished for the day. Take care. Nellie, you can take us on live.
All right, ending live